All right, so it's 12:02. I want to say a huge thank you to everyone who took the time to join us today. And thank you also for joining us on time. We're going to go ahead and get started because we have over 160 participants already on screen with us here. So welcome to each of you. My name is Joanne Morne, and I am the Executive Deputy Commissioner at the New York State Department of Health. I am honored to be able to join you and my friends and partners at Blooming Health for today's discussion with some really great colleagues from across the state who are actively participating and leading as it relates to the social care networks in relation to the 1115 waiver. I'm going to offer just briefly an overview, if you will, of the 1115 waiver and what that is. I'm sure that all of you are well versed in these discussions, but at the same time, sort of want to set the stage for the discussion, recognizing that today we're really focusing on the social care network. So feel free throughout to use the chat as far as providing your name or providing information on how to contact you. Even though we're virtual, there's still networking opportunities that we should all take advantage of. Before I go into the actual start as far as the 1115 waiver and setting that foundation, let me just take a moment to introduce who's joined us here on the screen. Certainly starting first off by our colleagues and our hosts for today at Blooming Health. We want to say thank you again for the opportunity. And introducing our three panelists who are taking the time today to talk about their own experiences for themselves and for their teams as they are moving out with their initiatives. First, we have Nikki Kaminsky, who's the Executive Director of Western New York Integrated Care Collaborative and from Buffalo, New York. We have Ami Parikh, the Chief Executive Officer with Hudson Valley Care Coalition. And we have Zach Hennessy, who's the Executive Vice President and Chief Strategy Officer from Public Health Solutions in New York City. So welcome to all of you and thank you for being willing to come and share your experiences and your insight as we move forward. I'm going to take just one moment to share my screen. How did I do? Can you see my screen? Okay, and it should say 1115 waiver to the left. All right, thank you for the confirmation that that's there. I'm going to click through so I can get to the main points. So just as a brief summary, the 1115 waiver, which is a tremendous amount of funding and support from our federal government. In fact, a $7.5 billion agreement that looks at prioritizing and really providing support to a number of different areas as it relates to healthcare and certainly to our social care networks. It looks at offering the opportunity of support in Medicaid hospital global budgets. Most importantly, and as you know, the 1115 waiver is most often framed and discussed from a perspective of health equity and looking at the opportunities to reduce, if not eliminate, health disparities, which we know are absolutely essential to address if we intend to move forward in improving individuals' health and overall satisfaction of life. I highlighted the establishment of the social care networks as that is a main focus for today's discussion. And also looking at the opportunities of creating loan repayment programs for health professionals. We know that we are in the midst of a workforce crisis, and we know that we have to be innovative in looking at opportunities in which we can continue to build our workforce. And incentives such as loan repayment certainly is one of those areas to consider. Establishing the career pathways training program, which again looks at building our workforce and investing in both behavioral and social care services, looking at nutritional and housing support. The determinants of health that individuals most often report as acting as barriers to accessing care or sustaining any level of care or treatment that they may be currently engaged in. So one of the things that I often talk about as it relates to this year's 1115 waiver is that 1115 waiver is not new to New York State. What is new is the model within which we are moving forward at this time. And part of that model is based on the fact that, number one, we always have emerging issues that we need to take into consideration and respond to. And number two, that we also have to take the lessons learned from the previous waiver experiences. Some of you who have been engaged in this work for a period of time will certainly understand and remember the history of the 1115 waivers, including the inception with the Medicaid redesign team, the MRTs, in 1997. So, since that time, if not before, we certainly have seen New York State be a leader as it relates to looking at innovative practices, and certainly as it relates to ensuring that there is community stakeholder and partner input, particularly engaging individuals with lived experience. Our DSRIP accomplishments, looking at reducing avoidable hospital utilization, advancing integration of physical and behavioral health care, as well as increasing participation in value-based payment arrangements. I spoke earlier of lessons learned, and I think that anytime we look to implement change or we look to start up a new initiative, it takes a period of time for us to get there to fully understand and have the data, if you will, the evidence to see what has positively been impacted. But there also, of course, continue to be opportunities for us to improve. And so here we are now with the New York Health Equity Response and looking at the 1115 waiver amendment, and specifically recognizing that of January of this year, there was an approval from CMS in the amount of a $7.5 billion package, which also include nearly $6 billion in federal funding for this health equity focused waiver amendment. And that stays in effect through March of 2027. So specifically providing information to the social care networks and sort of laying a foundation for the discussion that we're going to move forward with our panelists. What we're looking at are certainly prioritizing, looking at the individuals who perhaps are the highest utilizers of services, including individuals who are experiencing or have experienced homelessness. Considering those individuals who have chronic conditions, 2 or more chronic conditions, and while also enrolled within a health home model, which also is a longstanding initiative in New York State. And looking at individuals with substance use disorder, SMI, which is serious mental illness, or intellectual and developmental disabilities. You can see here, continuing through the list, where our prioritized individuals or populations are listed, recognizing that these individuals have historically presented with needing additional supports as well as safe spaces in order for them to not only engage but sustain in healthcare services as well as in behavioral health services as well. Again, our goal here from a health equity perspective is looking at advancing the principles of health equity, ensuring that people have access, as well as ensuring that people have the same opportunities for which they can move forward with a very, what do I want to say, prioritize health and life satisfaction. Okay, I'm going to stop sharing. Am I off screen now for sharing? No, I'm still sharing. Oh, here we are. Okay. Give me just one moment. Oh, here we go. And while I'm looking to take my screen down, encourage you still to.
You got it.
Oh, we got it. All right. I think I had a little help from my friends there, and I appreciate that. Again, I see people are using the chat, so grateful for that. Feel free to continue to do that as a place in which we can communicate. And again, even on screen, able to network. So wonderful. I introduced our panelists before. I want to offer you a huge welcome and a thank you for being part of today's discussion and providing us with your own experiences and the experiences of your organizations as you look at developing and advancing the social care networks. I provided a very brief overview of the 1115 Medicaid Waiver Amendment and focused on some of the prioritized areas, but I'd be interested to hear from each of you exactly what the 1115 waiver has provided to your organization and agency, as well as how you will be advancing a social care network. Why don't we go ahead and start with Nikki?
Hi, everybody, and thank you, Joanne. Thank you to Blooming Health for organizing this, and excited to be here with our fellow SCN leaders. So really with the 1115 waiver, Western New York Integrated Care Collaborative is considered a community care hub where we have we're around 80 now CBOs in our network. We're partnering with health plans and we're delivering services delivered through the CBOs. So we act as that administrative hub for them with the contracting, the billing. So this new waiver is an opportunity to now expand kind of rapidly. We say we're going on steroids, our model, right? So to now be able to provide these really important services. This is an unprecedented funding opportunity for community-based organizations. So we'll really be responsible for helping those community-based organizations get involved, get upfront funding, and be reimbursed for the services they do, which is really, it's a rather new concept. They're used to, getting grants and kind of seeking donors. So we're helping them get ready for that, partnering with the provider groups, with all the different stakeholders in the community, and then with the managed care organizations to do the contracting and the billing and all that. I'll pass it on to one of my colleagues that wants to add more.
That's great. Ami,
So
did you want to share?
I'll just add a little bit. So in the Hudson Valley, we're also partnering with our county governments. We felt that all 7 county governments signed on to supporting our development and implementation of our social care network. We felt it was very, very important to include our county partners because the level 1 health-related social needs services, HRSN services, are really the state, the federal, and the county level resources that we have. And so county governments involving our hospital partners, we have about 4 or 5 hospital systems in the Hudson Valley area that we're in contact with, and we're gonna be working with them. And then our RIOs. RIOs are also a very important component to this waiver. There is a huge technology component, not that there wasn't in DSRIP, but this one, the CBOs will be participating directly on our IT platforms, which are referral management platforms and care management platforms. And so I think I'll pass it on to Zach if he would like to add anything more.
Sure, thanks. And it's great to be here today. I just want to take a step back for a second and talk about why Public Health Solutions has decided to participate in this next phase of healthcare reform. Every year, hundreds of thousands of New Yorkers avoid healthcare due to concerns about putting enough food on the table, their housing situation, their family priorities, and other unmet needs. By the time they seek help, their health is in crisis and their lives are cut short. This is the story of thousands and thousands of New Yorkers and hundreds of thousands of Americans across the country, and a huge driver of life expectancy. The goal of our whole UNYC network in New York City, which is public health, coordinated by Public Health Solutions, but inclusive of over 200 community-based organizations and healthcare partners, our goal is simple. It's to improve access, trustworthy and reliable access to community resources, because the right resources at the right time can save lives. just one personal example is my own, when I was 5, I lost my mom. She was 31 years old. She had a heart condition. It was detected during her pregnancy with me, so 5 years before she died. And she was uninsured and economically unstable. And in her journal, she wrote over and over again about experiencing symptoms and how she had been given this referral to a cardiologist. She never made it. By the time she was hospitalized, it was too late to save her life. This is one story of thousands and thousands of American stories. And so what we're trying to do now is really revolutionary. Who thinks of their health insurance plan as being able to support them with rent, as being able to provide them with transportation to their social worker, as being able to bring meals delivered to their home, to a bag of fresh produce, fixing their, remediating their home so that they can breathe better. These are all new things that Medicaid will be paying for through this waiver and delivered by community-based organizations and administered by the social care network. So we take this stewardship very seriously, and we see it as an incredible opportunity to begin to make those resources more available to the people who need them the most.
Well, first of all, Zach, I just want to say, I want to acknowledge and say thank you for sharing such a personal story with all of us. And certainly sharing that with the intention of presenting the example that too many people continue to experience in their lives. So thank you for that. One of the themes that I'm hearing from all of you certainly is that there is a huge need here in creating social care networks by name and by intention of partnerships and working across the regions in order for the needs of individuals to be met, recognizing the determinants of health that Zach, you spoke of, and understanding the barriers that a lack of access to those determinants of health can have. Can you talk about in those partnerships, where do the CBOs or the community-based organizations, so what is the role that they have and how are the networks developed? And I'm going to open that up to all of you.
And I can go first. So CBOs, they have the opportunity to provide these important services. So one thing we're working on with them is right now, the SCNs are getting a lot of information from the state on the requirements, the fee schedule, the scopes of work specific to doing the actual delivery of services. But we're telling our CBOs, we have kind of the general headers of what services. So if they're already providing food services, nutrition, transportation, care management or navigation to services, housing, remediation, medical respite, housing navigation, that they really should be taking an internal look at what they currently can provide and what do they need internally to be able to take on more and maybe a lot more, so that when the SCNs are ready to reach out to them and work with them, they've already kind of done some of that internal introspective thing. If you think you need, we're going to need a couple people, we're going to need to hire, you could start be thinking about your job descriptions. It's either the type of things you internally could be thinking about, but that they will really be integral. Also, not only on the delivery of services, but getting the folks who need the services engaged into the system. The very first way that a member will be able to see if they're eligible, is they have to complete a screening that the state has designated, a set of questions. So CBOs are often very connected with the community that they work with. So they will want to be engaged with the SCN on the outreach and communication plan and where can I direct people. So these are some of the ways the CBOs will really be important to this whole system.
Thank you for that, Nikki.
Yeah.
Any,
So-
Zach? or
Yeah, I
Ami,
just want to emphasize that the role of the CBOs are paramount. I think some lessons learned, and to build off of the response from Zach and Nikki, the people who will be accessing services from the community-based organizations, they trust those community-based organizations. They are in the community day in and day out, supporting our members, supporting our individuals in our communities, and they know them, they trust them. It's the food pantries, it's the community-based organizations that have been providing services for over 30 years. You all are the ones that they trust. They won't know the Social Care Network. They won't know Hudson Valley Care Coalition, but they will know, I'm going to name some names in the Hudson Valley. They will know Access Supports for Living. They will know Human Development Services of Westchester, because they're down the street and they see them, right? So the role of the CBO is just paramount in the success of us developing whole health approach. And I think finally the federal government and state governments across the United States acknowledge that CBOs have been doing this for years. They've been supporting our members, keeping them out of the hospital, keeping them fed, keeping them safe in their communities. And finally, they're getting acknowledged as part of the continuum of care, specifically in the healthcare. And yeah, it's the community-based organizations that are gonna make this whole thing a success. And it's an honor to expand the network. It's an honor to really develop this community-based ecosystem of healthcare, because to Zach's point, they will access those services because they trust the community-based organizations. And hopefully we can catch people before, like your story, Zach, that we can catch people before crisis, that we can go further and further upstream and get into prevention.
Zach, did you want to add anything? Thank you. Amy.
Yeah, our goal with the social care network is to stay rooted and grounded in the community. We believe community health is community-based organization health, and that community, having community governance and community stewardship is essential to building that trust that Ami was talking about. So we have established a coalition, a CBO working group, and we all have to have 51% community-based organizations who are representative of our regions as members on our respective governing bodies. So we're really all committed, and we were all advocating for this and very pleased to see this requirement from the state, because we heard time and time again from our community-based organization partners that without a seat at the table, this wasn't going to work. And what we're going through right now is, us specifically in our region, is a community-based organization needs assessment and a Medicaid member advisory council. And over the next 3 months, we will be doing individual interviews with community-based organizations, as well as focus groups of those Medicaid member advisory council. And that information will be used to determine the resource allocation of our capacity building funds for CBOs, which our governing body will decide. So our governing body, which will include 51% CBOs, will be taking this information from our needs assessment survey and our Medicaid member input, and they will be setting how many dollars and what kinds of training, technical assistance, and capacity building our network will provide. And we're really proud of that approach. And I'm putting it out there today to encourage anyone who hasn't gotten, any CBO who hasn't gotten in touch with us yet, who is in serving Brooklyn, Queens, and Manhattan, please do so. You can be a part of this process.
Zach, I'm really glad that you started the discussion as far as the resources, right? So let me just say, on a personal level, my career for many, many years was within community-based organizations. So I am a huge supporter of community-based organizations. And at the end of the day, I think that we can all agree community-based organizations are the foundation of public health. And when you talk about public health, you're talking about all health, right? There's a continuum here. So if you look in the chat, you'll see that there's certainly many, many comments and speaking about, number one, how grateful people are for the fact that we've created this space. And then number two, the recognition of the community-based organizations. So I want to continue on the theme that you started, Zach, in talking about the resources, because certainly we recognize that community-based organizations need to have adequate resources in order to do the good work that is necessary every day within each of your specific areas for the purpose of today's discussion. So how are community-based organizations reimbursed or paid as being a part of this network? And how are they able to expand and enhance in the existing services that they have available that speak to what Nikki touched on, the trust development, which results in effective engagement and access? That's open to all of you. Zach, I know you spoke on it, so.
There's yes. From our perspective, there's two funding opportunities for community-based organizations. The first includes training, technical assistance, and capacity building resources. These are startup dollars that each social care network had allocated as a part of their budget to the state to directly fund workforce needs, technology needs, and training needs of our CBO members in our networks to get them ready. We'll be doing some readiness assessment work. You know, our CBO partners will be sharing with us what types of services they think might be a good fit for them. And then, as I mentioned, our governing body will be allocating resources to meet their unmet needs, what they need to start up. And then the second is once we're in the service delivery phase, and we fought hard, advocated hard for community-based organizations to have a role in screening, because we know many communities are disconnected or distrustful of traditional healthcare settings. And so, and many CBOs may not be providing housing services, but they might be an incredible outreach organization or a culturally specific organization. And so we wanted a role for them to be paid in actually reaching these members and making that first engagement with them to assess their needs, screening and navigating. And then there are the services. And, you know, I'm going to be very transparent and say that this business model needs to be assessed, and our social care network wants to work very closely with CBOs to assess the rightness of fit for a specific service. You know, a lot of these costs will be predetermined in many ways, or at least bound in certain ways. And so we will work with our CBO partners to take a look at what makes sense given their mission, their current scope of work, the work that they've already done and have experience doing, to come up with like projections for how many of these services they might provide and be paid directly paid by the SCN through contracts that we hold with managed care plans.
Thank you. Ami, anything to add?
I think Zach covered it. Like there's two buckets. There's the capacity building bucket, and then there's actual service delivery bucket. Hudson Valley Care Coalition, we're still trying to work through of how the capacity building dollars will be dispersed amongst the CBOs. But we've made a commitment to our communities that it will be a significant amount of the $44 million that's been allocated to the Hudson Valley area. I think, yeah, that's it.
Thank
I
you.
would just encourage CBOs who maybe right now are like, we have no capacity to do this right now. We are like, I don't even have we talked with one food pantry who said, we would love to, maybe do the pantry stocking, but we don't have any freezer space. Well, freezer space could be something that could be an upfront infrastructure fund that could allow them to do more meals. So just be really, know that there's potential upfront funds to get you ready to help you have more capacity. Because says both Zach and Ami's, they're the really key components is getting really robust networks in all of these regions. And I did want to add, that all the SCNs, we have been meeting for 2 years now, that we really are a collaborative group. This is not a competitive thing amongst the regions. We really want to try to align as much as we can, because we know a lot of CBOs cross regions, and we don't want them to have to, as much as we can. There's going to be some differences, but in Western New York, we're at the farthest, toe of New York State there. We're working really closely with Finger Lakes. They're one kind of border SCN. So we really want to make sure that our partners that work in both have a real easy way to learn both systems, that we're aligning as much as we can. So I just want to throw that out there to let CBOs know that we're aware that if you're working in multiple, and then let's say a member, we're really looking at it from the member perspective too. To Zach's point, we also have a community advisory council we're standing up. We want to make sure that in real time we're hearing their issues, that we can address them, any barriers. But if a member moves from one region to another, we want to make sure there's a seamless way that we can all communicate and make sure that person still gets services. And so these are all the things that we're trying to figure out and plan in the back end, while I'm sure a lot of people are waiting, like, when are the SCNs going to start getting this going? There's so much that we're learning and figuring out right now, because we really want it to be as easy to work with the CBOs and all the partners as possible.
Yeah, I want to say thanks to all of you. I think there are really good points that are being made, and they're aligning with some of the questions that I'm seeing coming in. As we talk about, and what you're talking about in these networks is really looking at the whole person, right? And so I want to just acknowledge, I think many of the points and even the details as far as how the networks are moving out, these aren't new conversations for many of us who have been doing this work, right? But what I'm hearing is that it's sort of an invigorated conversation with a framework that really is focused on, number one, prioritizing community networking and community-based organization leverage within the regions. And then number two, looking at prioritizing those individuals who have presented with having some of the most significant needs, right? So going back to the point on the framework of health equity. So huge thank you for the planning that's gone into this. So let's stick up with some of the themes that you've brought up. I think that those who are participating today, they're interested in hearing, and you've talked a lot about the points of communication, right? So the councils or the advisory committees, and I'm sure within that, and you can provide detail, how are we sharing like the innovative ideas so that we don't always have to sort of recreate the wheel? How are we sharing maybe some of the lessons that are being learned? So are there ways, and you talked about this, Nikki, how communication will flow within the regional networks and amongst the regions, which is one. And then two, yes, there's lots of interest as it relates to timelines. So you've made the point that certainly planning, discussion, and networking has been around for a number of years under different names, perhaps over time. But how do we move forward with the timelines for this particular discussion and planning? Why don't we start with Ami? Sorry, surprised you.
So timelines. Our deadline to launch is January 1st, 2025, right? So the way that HVCC is looking at this is that we're taking Q4 of 2024 to plan and begin to work with our CBOs. We are going to be implementing a readiness tool similar to what Zach talked about. We will assist you and walk you through the contracting phase. There will be an extensive training phase as well, training on content, both cybersecurity and other kinds of training, and then training on our IT platform, training on how to screen, and then navigate, and then you guys deliver the services. So we are not going to train on delivering services. That's your wheelhouse. So timelines, we're taking Q4 to do that. So that's what HVCC will be doing in September, October, and November and December, really preparing our CBOs to begin to screen and navigate and operate in the social care network. Did I answer your first question, Joanne? I don't know if I answered your first question.
Yeah, I mean, based on the comments that you provided and the details, I think it builds on that. So thank you. Nikki?
Yeah, aside from, I totally agree. We're kind of on the same, we're all on that Jan 1 deadline to implement services as of right now. So we've kind of taken exactly, we go backward. What do we need to do in December, November, October? So with CBOs, we're right on the same pathway as Hudson Valley. There's just a few more details we are looking for from the state that are they're coming in, and we're getting them. So then we can really start launching full bore with the CBO. With providers, we're partnering with our QE, which is the qualified entity, or the Regional Health Information Exchange in our region. That's called Healthy Link. We're partnering with them to reach out to our providers because they have options too. The healthcare providers, if you will, the doctor's offices, the FQHCs, they have options in terms of how involved they would like to be. We would love for them to be as involved as possible because, they see, a big chunk of the population come into their clinics and their offices. So they have the opportunity to screen. They have different options they will for how that screen gets to us, whether it comes through us or comes through Healthy Link, for example. And then also some of the offices might provide some of the health related social needs, like the navigation. Or we have a couple clinics that have their own food pantry. So then we'll be working with them as well as a health related social need provider. So we're also working with them, and then we're also meeting all the different managed care organizations. We'll have to contract with each one of them and have a contract, receive payments from them, send them claims. We have to get all that integration going and flowing and testing the claims. We don't want to be starting these services and not know that the claims are going to go through and not get a bunch of denials and all that, because we want to be able to pay the CBOs for the services they do on that timely manner. So all that's happening in that from now until December to get us ready.
Thank you. Zach?
Yeah.
Yeah, we are just really focused on building the community infrastructure that is necessary for this new payment model. But I want to emphasize kind of the opportunity along the way with the Medicaid waiver and when it comes to technology, because currently in New York City, there is no coordinated technology-enabled access to the social safety net. Does not exist. We take it for granted that when we pick up our phone, we can order whatever food we want from every restaurant nearby through one application. We take it for granted that we can do the same with transportation. right? Our commercial needs are holistically met. Thank you, Amazon, right? The interest, and I say this because I want people to stretch themselves when they think about participating in this, because community based organizations are going to have to look at where it makes sense economically for them to participate in this. And we at Public Health Solutions have a commitment to this becoming one of many investments in what is currently a missing piece of the public health infrastructure. So it might be that, as we introduce with our CBO partners, different services, they might take a look and say, this doesn't work for us, or we serve mostly people on Medicare, so I don't know if we're going to get the volume we need on this service. We encourage you to still participate in this process, because we think it can be so much more, so much bigger than just Medicaid. And if we're talking about equity in a place like New York City, we have to leverage this infrastructure on behalf of other people. We have to leverage it on behalf of migrants. We have to leverage it on behalf of people on Medicare only, and people who are completely disconnected from healthcare. So.
Thank you for that. I recognize that we have 2 minutes left to our time together, and that seems impossible, but it's actually 12:43. We are scheduled till 12:45, and certainly want to respect everyone's time and the time that you've taken to join us today. What I want to say is that this is the first in a series of conversations that Blooming Health is going to be hosting and facilitating, so that we can continue to create space for dialogue and answer the many questions. I want to, yeah, there we go. I want to acknowledge we have certainly a number of comments in the chat that speak to contact information of individuals and community-based organization representatives. So perhaps that chat can be shared with our panelists as you continue to work and advance in what you're doing. We also have a number of questions that have come in. So just to give you a sense, and I think this is really a yes or no, can a community-based organization join more than one social care network, acknowledging the comment made about being in multiple regions? That is a definite yes. I'm seeing
Yes.
from the panelists, that's great. And I'm also, I see a number of people have asked a question related to specialized community-based organizations. So perhaps an organization that is focused on providing care support service to aging individuals. Those community-based organizations are also welcome to be part of the networks. Am I correct? Okay, and
Yeah.
I know that there are nuances here, right? Because maybe the conversation recognizing Medicaid support versus Medicare support, and acknowledging those individuals who are duly eligible, right? So there are nuances to that, and perhaps the best way to get a direct answer on your particular organization is to reach out to one of our panelists who have been kind enough to share their information here. So again, our panelist, Nikki, my goodness, Nikki, I did it so well the first time, Kaminsky, Ami Parikh, and Zach Hennessy. We want to give you a huge thanks for the time that you've taken to join us today to provide some of the beginning points of conversation as far as the networks. We also would offer you the QR code here that you see. Just put your phone up to that, and it will bring you to a link that will continue to provide information on simplifying and streamlining social care. So we are going to close out now. We want to say thank you again. Please continue to look at the opportunities through Blooming Health as it relates to continued discussions on the 1115 waiver and other social supports that our communities across New York State are benefiting and growing from. A huge thank you to our panelists for your insight. Thank you.
Thank you.
Bye.
Thank you, Blooming Health, for hosting. Thank you. Thank you, Joanne.
Thank you.
Thank you, guys. All right. Thank you, guys. that went great. I'm gonna head out.
All right. Thanks so much, Nikki. Take care.
All right, thanks a lot, Nikki. Thank you so much, Joanne, for hosting this. It was amazing. Really
Yeah.
Okay. Was it okay? I was trying to, I realized I didn't have phone numbers because I was trying to text to say like, are we doing okay? Is the cadence good? So